Officer of Northwestern Medicine at Central DuPage Hospital joins us now on the phone to discuss the latest COVID-19 developments. Thanks for joining us again.
Good morning, Robin. Larry, how are you guys?
Good morning.
I'm doing well. So we're seeing that we're getting estimates that this curve might be peaking in the next week here, and then it starts to flatten, they say. But some say that flattening of the curve might extend through August. Does that mean we're inside till August?
It may be we're inside for a little bit longer than we expected right now, because I think you're going to see with this drive-through testing, you're going to see the number of cases spike up. And as I've said in the past, really the biggest number that we're concerned about is how many people are in the hospital, how many people are in the intensive care units. That's the number that we should be focusing on, and that's the one that we need to flatten, because that's where our surge problem is.
So if the testing numbers are going up, but the number of people in the hospital is going down or staying the same, why would that extend the stay inside order?
Well, because now, Robin, we're at least going to be able to identify the asymptomatic people. The testing that they're doing now in the drive-through is people with symptoms. Personally, this is just my own opinion, we should be testing as many asymptomatic people as we can. Anybody who has symptoms, assume you're positive and let's do the blood test later to see if you did. Our goal is to stop the spread, and unfortunately that spread is happening because we have asymptomatic carriers that are out there still.
And there's a study, and it doesn't seem to be published or peer-reviewed yet, but it says that this could be infectious in the air for 16 hours. What are your thoughts on that?
Yeah, Larry, it's one of our biggest concerns, and it has been a big concern. You know, there's a difference between aerosol and droplets. We've always considered this a droplet issue, so that when someone coughs or sneezes, it's only going to go 6 to 8 feet and drop to the ground or drop to a surface. But we know that asymptomatic people, so people who aren't coughing, people who aren't sneezing, are still spreading this. So we know that aerosolize can happen with just simple conversation. So again, very important there that we keep our social distancing, but now the concern is with ventilation, are we blowing this virus around in a closed environment that people could still be exposed to? Again, a good reason to get outside and to make sure that you have good ventilation within your house.
You're meaning open the windows?
Yep. Open the windows when you can, get fresh air when you can. This study, it was done at 4 different places, so we'll have to test it, but it's always been in the back of our mind because of the asymptomatic spread. But again, when an asymptomatic person is talking, they may be spreading virus, but at a very low load. So I wouldn't be overly concerned that this may be more science than actual data.
Before we let you go, you want to talk about how hospitals are dealing with people that are sick not from COVID-19.
Yeah, Robin, you know, we have to realize that COVID-19 has not stopped strokes and heart attacks and appendicitis and cancer and heart disease. So, you know, I just want to make sure that everybody is reassured that hospitals have taken that into consideration. We're looking at what we're going to do as we come out of the peak and how we're going to take care of these people with this pent-up demand. The individual who needs their colonoscopy for cancer screening should not be canceling it. He should be postponing it so that we make sure that we're still taking care of ourselves, and we still know that there's other chronic illnesses out there that we have to be careful and watch out for. And don't ignore the symptoms and signs, because that's what we're seeing now is some heart attack victims coming in that had not been thinking about COVID may have come to the hospital sooner.
All right, Dr. Most, thanks for joining us again.
You're welcome. You guys take care.
You too.
Thank you, Doctor.